Tonight, bitten by the bug, the surge of concern over a hidden hazard of summer.
I could barely walk, I could barely function.
The insect-borne illness that is spreading across Canada.
We're getting about 2,000 people a year.
And the debate over diagnosis. Does our healthcare system pass the test?
CTV News with Lloyd Robertson. Sitting in, Sandy Ronaldo.
Good evening. We begin tonight by highlighting a mysterious malady that's a little known in much of Canada but appears to be spreading. It starts with a bite from a small insect called a black-legged tick. Then, if you're unlucky and the tick is carrying an infection, a circular rash develops. That signals the presence of Lyme disease, which is well known in the eastern United States as being potentially very serious. In Canada, there's an additional problem. It may not be recognized and given timely treatment. More on this from CTV's medical specialist, Avis Favreau.
For 9 months, Sharon GOERTTEN lived a mystery.
I had unrelenting headaches and terrible stiff neck and excruciating bone pain.
Her doctors tested her for MS, lupus, even for bone cancer. Until this doctor diagnosed her with Lyme disease.
My journey to diagnosis was frustrating. It was disheartening.
The disease is carried by black-legged ticks. Bites can cause a circular rash that can lead to pain, confusion, even paralysis. Canada's Public Health Agency estimates there are about 50 cases across the country each year.
But overall, I would say the risk is low of coming in contact with a tick, and then coming in contact with an infected tick is even lower.
Right now, we're getting about 2,000 people a year.
But those manning support groups say the disease may be a much bigger problem.
The number of people contacting us annually leads us definitely to believe that there are several times, many times more cases of Lyme disease in Canada than what our government authorities are letting on.
If a doctor doesn't recognize the symptoms, then they're not going to diagnose the problem.
Some suspect the low Canadian numbers may have something to do with the Canadian blood test, which some say is unreliable.
They're told that if your one test is negative, you do not have Lyme disease, which is very erroneous.
At my sickest point, I was bedridden.
JOANN Bone's blood test came back negative for Lyme. When she sent it to a U.S. lab, it instead said she was positive for the disease. She was then successfully treated with antibiotics.
But I pushed on, I went through the medication, and I feel incredibly great now.
Health officials maintain confidence in the Canadian test.
The Lyme tests that we do are reasonably reliable. The tests themselves, the standards and the protocols are in general agreement with those used in other countries.
But getting the correct diagnosis is critical because antibiotics can eliminate Lyme disease. After 9 months of mysterious pain and fatigue, Shannon began antibiotic therapy a few weeks ago.
I woke up and I was completely pain-free for the first time in a year.
But there's a flip side to the story, a worry by some doctors that Lyme disease will become a sort of fashionable diagnosis to explain any sort of non-specific illness. And they say there are risks to treating people indiscriminately with antibiotics. That's why they say better diagnostic tests will be needed. Sandy?
Well, I'm sure the question that everybody wants answered is there any way to protect yourself from Lyme disease apart from avoiding the woods or contact with animals in the woods?
Absolutely. You can check if these ticks are in your area. You can stay covered up if you're going into wooded areas, socks and shoes and long pants. You can use insect repellent containing DEET that repels these ticks. If you've been out for a walk, doctors say it's a good idea to check yourself for these ticks on your clothing, on your skin, and remove them very carefully. And then if by chance you were to develop symptoms of Lyme disease, which we will have detailed on our website, you should go see your doctor quickly because you can get treated.
Thanks, Avis. CTV's Avis Favreau in Toronto.